This is an introduction with Tamar, April Sanchez, and Shamya. Mr. Martin, this one's for you. Here we go. With a dab of organism, with a dab of organ system, with a dab of organs, with a dab of tissue. Levels of organization is what we do. Anatomy and physiology with our crew. Organization and function. In there too, with a dab of cell, with a dab of organelle, a dab of macro, molecules. Hey, we can't leave out atoms. It's in our crew. Anatomy and physiology is what we do. Organization and function in there too. Hey, we're about to start with metabolism, like the characteristics of life. A prism. Hey, April. Let's list them. Here we go. Here we go. Here we go. Movement, responsiveness, growth, reproduction, digestion and absorption, circulation, assimilation and excretion. Characteristics of life. Finish. Completion. This is how we maintain our life. Requirements of an organism: first water, foods, oxygen, heat, and pressure. You could say we're fresh, but Mr. Martin's fresher. Homeostasis. Back to the basics. A stable internal environment. Homeostasis. Factors are external and internal environment. Our body is like Bryce Martin. Delicate. Homeostatic mechanisms are self-regulating control system composed of three components who aren't our opponents. Our receptors, set point, and effectors can bring us back. If we pass our set point, we call this negative feedback. Okay, slow down and break down. Exoskeleton is our head, neck, and trunk, while appendicular are upper lower limbs. Don't be like Mr. Martin in a textbook. He always skims. Oh, okay. Here we go. Talk about our cavities. The brain is in the cranial cavity. Vertebral canal houses the spinal cord. Thoracic cavity holds heart and lungs. Abdominal cavity has digestive organs, spleen, and kidneys. Pelvic cavity has the bladder and reproductive organs. Don't hurt yourself or you might have to call Morgan & Morgan. But wait, there's more in store. Okay. We have our anatomical positions. You don't even know what you're missing. Now we're about to start. Stand them straight, palms facing forward. You got it, mate. Here we go. Relative positions. Superior, inferior, top and bottom, anterior, posterior, front and back. Medial cut is left and right. Lateral is towards the side. Proximal is a pointed attachment. Distal is the other way. Superficial means towards the surface. Deep is going down. Okay. Next section.
Talking, walking, breathing, and sneezing can all be done by the muscles using skeletal, smooth muscle, cardiac. Put that on your plaque, here we go. Skeletal muscle, don't let it pause or stop or hustle. Composed of nervous and blood, it helps get us out the mud. Skeletal muscle fiber, get with it, be a subscriber. Contraction relaxes and stimulation. Ask all them Haitians.
Thin, elongated cylinder, rounded ends, and they can extend. Myofibrils, myosin, actin, they help us move when we're snacking. Myofibrils contract the muscle when we're in the middle of a tussle. Myosin are thick protein filaments responsible for forcing all the movements, acting used for mobility and contraction. In division, now we're in action. Here we go. Skeletal muscle actions. About to explain it to you with some passion. Please give us all your satisfaction. The movements are flexing and extension, flexing of the forearm at the elbow. A, we use it when we throw, extension at the knee. A, it helps you when you need to pee. Here we go. Smooth muscle tissue. Contains filaments of actin and myosin. Located in veins and viscera. Muscle has two types, multi-unit and visceral. Multi-unit contracts in response to stimulation by motor impulses and certain hormones. Visceral, smooth muscle display. Rhemicity pattern of repeated contractions. Very similar to skeletal muscle. Contain contraction longer. Smooth muscle can change with no tension. Now let's get it. Cardiac muscle. Branch striated, interconnected. Helps us get us body perfected. Contains mitochondria containing ATP to get to Austria. Cardiac muscle cells have intercalated discs help join the cell. Impulse pass freely. Contraction and relaxation again and again. Cardiac muscle to pump our muscle. Letting blood run while we hustle. All these network of cells acting like a unit in self-excreting arithmetic. Oh yeah.
Bones can help the muscles with attachment, produce blood cells, store inorganic salts, and form passageways for blood vessels and nerves. Blood vessels and nerves. Bones can help the muscles with attachment, produce blood cells, store inorganic salts, and form passageways for blood vessels and nerves. Blood vessels and nerves. Bones have a classification. It's separated by shape. Long, short, flat, irregular. Ribosubstance adjacent. Axial skeleton. Skull and mid-ear bones. The other part has upper limbs, a pelvic girdle, and lower limbs. The facial bones make up your face. Vertebral column can't take their place. Thoracic cage can't take their place because it holds the ribs in place. The sternum's in the vertebrae. Lower limbs hold the hand in place. Upper limbs hold arm in place. Pectoral girdle is where the shoulders lay. Break the pelvic girdle, you won't be the same. Bones can help the muscles with attachment, produce blood cells, store inorganic salts, and form passageways for blood vessels and nerves. Blood vessels and nerves. Bones can help the muscles with attachment, produce blood cells, store inorganic salts, and form passageways for blood vessels and nerves. Blood vessels and nerves. The mandibles, the jaw, craniums, the head. The frontal bone forms the skull, parietal bones on the roof, sinuses, a cavity, reminiscence, a curved part, outgrowth is tubercle. The notch is a V-like depression, line is similar to the crest, epiphysis at the end, forms a hole with blood vessels. Fossils like a shallow ditch. Faucet holds a surface. Flat bones edges the margin. Long section of the long bones diaphysis. Tuberosity is where muscles attach. Bones can help the muscles with attachment, produce blood cells, store inorganic salts, and form passageways for blood vessels and nerves. Blood vessels and nerves. Bones can help the muscles with attachment, produce blood cells, store inorganic salts, and form passageways for blood vessels and nerves. Blood vessels and nerves.
This is blood. The blood transports nutrients, oxygen, waste, and hormone. It produces body heat to keep you on your feet. Red blood cells, white blood cells, platelets can all be found in the extracellular matrix. Helps maintain a stable internal environment. Here we go. Red blood cells contain hemoglobin combined with oxygen. It also increases surface area. They're about 2.4 to 6 million. Red blood cells in the body. They are best blood cell count determines the oxygen capacity. The last mitochondria, red bone marrow, produces these cells. White blood cells protect us from disease. Count up to 10,000 in our body. Leukocytes develop from hemocytoblasts. Now let's put that in our past. Blood platelets develop in response to thrombopoietin. Giant cells, 360,000 in our normal platelet count. Helps close breaks in blood vessels. Blood plasma transport gases and nutrients. Regulate fluid and electrolyte balance while maintaining a stable pH. 55% of the blood is plasma. Break it down some more. Albumin, globulin, fibrinogen are all plasma proteins. Albumin makes up 60%, helps maintain colloid osmotic pressure. Globulin is next, 36%. Alpha, beta, gamma all function as transportations, lipids, and vitamins. Here we go. Fibrinogen, just 4%. Key role in blood coagulation, which means a blood clot. We don't stop. Hemostasis, stoppage of bleeding. For example, blood vessel spasms. Serotonin helps maintain these spasms. But wait, there's more. My favorite part, blood transfusions. Remember this. Here we go. Positive only gives to positive. Negative only receives from negative. Positive receives from negative and positive. Negative gives to positive and negative. And my buddy, oh, negative is unique. He can give to everybody, but only receive from his own body. That's him. He got it. We own it. We out.
Oh my god!
To the side.
I swear. Bro, your video about to be messed up, bro. What?
Future doctors, right?
Oh, that's what's going on. Oh.
Yeah.
I don't believe it. I'm scared.
Okay, put it down.
I've been recording for the longest time.
Oh, what are you recording for?
Martin's anatomy video.
Oh, okay.
Deep. And stop. Where's it?
You can Snapchat me at K-Sign K-A-S-A-S-A-U-N-J. Bow.
Okay. This is the introduction.
What's my money? Okay.
I'm gonna try to do walking, okay?
Okay. I'm gonna be talking, walking. Breathing is easy. Can be done by the muscles.